I was playing a pickleball game and my knee I pulled up short and it really hurt. And I thought I had torn a ligament, maybe an ACL, done some real damage.
You know, it's kind of hard.
I obviously ended up going to see an ortho doctor about that. And it looked at first like maybe I had stretched or torn an ACL. And I was really mystified that how did this happen so quickly, and is it ACL? Well, the next x-ray I had, I was bone on my knee, all osteoarthritis basically. And the doctor then told me that only a total knee replacement would resolve that.
All right, let's go.
I've led a pretty active lifestyle. Pickleball, which not too many people are aware of what that is, but it's a little bit like a racket sport.
Oh, beautiful, beautiful.
I was warned the first time we played that it's heavily addicting, and it is. And we usually play 3 or 4 times a week, 2 to 4 hours a day. All those difficulties that I was having with my knee, it was really impacting all my quality of life across a wide spectrum. And frankly, that made me feel older than I was. It seemed to me in my research that the Mako Striker system had the best opportunity to put you back in your life. And I certainly wanted minimally invasive, and I wanted the robotic assisted because I understood that was about as precise as the surgery could be done.
It was a great choice for Roland because he was active. We can move the position of the prosthesis on the bone a few degrees either way in order to correct the deformity in a much more precise fashion than we could do it if we did it manually without the robot. It is good alignment of the patella, and you can see here he's not...
Robotic surgery technology, the reputation of Dr. Shimento and the department in Ochsner, and the possibility that I would get the best job done and maybe be back in my life within a few months. But also because I was there at a unique time with this COVID. The sterility, the physical distancing, all of those new procedures that had to be put in place were done very well, very professional, very efficient. And when she screened me for the temp and everything, I said, now, which way do I need to go? And she could have said, go around this hallway and go down this far and then turn left and go this way. And she walked me to the place of saying that and said, well, here, I'll just show you. And just took me right to the elevators I think we were going to. I just took notice of that. So I'm very grateful. And I'm glad that I went ahead also and did it without waiting, because it wasn't magically going to get better. The diagnosis would remain the same year over year.
You know, for one of the things we do as orthopedic surgeons is we get people back the quality of their life. So especially with joint replacement surgery, it's very, very satisfying because that's why people come to us, and I think we accomplished that with Roland.
But I get compliments from the PT people and everybody else on this surgical scar because it's almost not visible. I feel able to do anything that I would like to do, and that's quality of life. As I mentioned, I'm retired. I have a good knee. I'm back in my life. And they did it with such professionalism and such personality. This was the right place for me to go, to have the best outcome I could have.